My hips and lower back have been bugging me.
Okay. So when did this start, and why do you think that's an issue?
I don't know, maybe past couple months and just work. I wear a belt, so like it's got a lot of weight and
How much weight on your belt?
probably a good like 20 pounds or so.
Okay. You've been wearing it for a while and it just started
Yeah, it started
aggravating.
bugging, and then my hips are just naturally like tight, so I don't know.
All right. Looking at your leg length, and your right is longer than your left. Okay, I'm gonna double check. Do you have any pain or discomfort when I move your SI joints?
No.
Are you working out all the time being in the law enforcement still, or is that ship sailed since you're out of the,
I try to work out as much as I can, but as of recently, it's, not been as much.
Okay. So when you say your hips are tight, where do you feel most of the tightness exactly? Can you point to it?
It depends on what area, or like kind of what position I'm in, but probably more so like that outer hip area, like when I'm in a butterfly stretch kind of thing.
Like in here?
Yeah, a little bit there, and then, I kind of feel it in my hip flexors too.
Okay. Gravity, sitting, standing, putting pressure on that lumbar, and then having a 25-pound belt on top of it. That's a lot of weight.
Mm-hmm.
They don't have an option of like a shoulder strap or anything?
We're getting the load-bearing vest, so that's a good alternative.
Oh, when does that come out?
A lot of people have them already, so I'll probably be getting ones pretty soon.
Nice. I think that will help a lot because it will be suspenders kind of holding it up.
It'll be almost like a weighted like vest that you use to work out, but you have it for all your equipment that attaches to it.
Okay. So down in here, ooh, he's so milky white. Do you have any pain in your lumbars?
No.
All right. Do you have any pain in your SI joint here?
No.
Here.
No.
The right side seems to be more posterior coming towards me than the left side. The left side moves easier. So we're gonna have to get that moved in this direction. Go ahead and take a breath in and out. Alright, let's do that again. Because this slopes down, I'm going to have you bend your knees, bringing your feet up, both of them. Good. Take a breath in and hold your breath for me. Hold. Good. And down. I'm going to do a little stretch, and it's also a test. Do you have any pain?
No.
And you had a big rib out right there. Okay. Little change, but not much. Sometimes having things out along the chain here can cause your low back to be off greater, but you truly have a little bit of dysfunction here in this joint. Your right side is posterior. I'm going to get that side second. I'm going to have you lay on your side facing me now. Hand on hand. I'm going to have you take a breath in, look over your shoulder, breathe out. Good. I'm going to do that a little deeper. Okay. We're going to do the other side. Okay. Move this so your knee doesn't hit. All right. Big breath in and out. That was a deep one. Little breathe out. Okay. Flat on your back. A lot of times you'll have some tension in your IT bands. Do you roll them out a lot?
Not a lot. I used to roll them out a little bit, but...
Right on your side. So we're friends. Just remember that. Don't kick me. How does that feel?
That doesn't feel good.
I don't like it. So, when you go to the gym, roll these out as much as you can. They're like little spiky ninja balls too. Have you ever seen a grown man cry? Alright, just a few more. 3. Two. And 1. And unfortunately, we have 2 sides, so we're going to have you flip over. So the IT band is the ilium and the tibial attachment point, and it's like a tuxedo stripe going up your leg of fascia. And fascia is ligamentous webbing. Doesn't have a big blood supply, so you have to physically go in there and flush it out. Is this side not as bad?
Not as bad as the other side.
Oh. All right, one more. Okay, flat on your back. And put this under your neck and down. Is there a reason why you popped that knee up? Is it
Hi.
comfortable
I don't know. It was just
in your
natural.
hip?
It could be. I don't know. I just naturally lay like that sometimes.
Sometimes with just the right side, or
I couldn't
you
tell
don't
you.
know. Okay.
Yeah.
Start to pay attention to that, because if you do pop it up and turn it out, that means your piriformis muscle is tight on your right side. That's when this foot, which it already is coming out further this direction.
Mm-hmm.
So the piriformis muscle is from your sacrum to your hip, and the sciatic nerve pierces through it. Again, it's like a little band. So you get an external rotation with the foot and the hip.
Okay.
And how we stretch that is by bending this, placing this right up here. I'm going to bring this side up and bend this as well. And you're going to feel it in your left
Right over here.
buttock. Good. And you seem pretty limber.
I'm not, but I think I'm more like limber on this side of my hip than I am on my left side.
Strange, because
Yeah.
you had that side popped and rotated.
Yeah. At least when I'm doing like this stretch in the gym.
Well, let's see. Let's check it out. Oh yeah, this side is so much tighter.
Mm-hmm.
Good. And your goal is to push this knee that direction. Oh yeah, I feel it.
It's tight.
Yes. All right. I am going to release everything else, and then we'll get you up and see if you feel a little looser or
Alright.
better. Put my hand underneath your scapula. Mm-hmm. Relax.
Felt that.
Yeah, I do too. Okay. Oh yeah, both
felt good.
scapulas pop back in. I'm going to traction your neck. Or make you have any pain or discomfort.
No.
Right. That dog. All right. How long has it been since you've been adjusted?
I don't even know. It's been a really long time.
Yeah, I feel all this right here. Do you feel a difference?
Yeah, it's a little more tender on the left.
Yeah. Gosh, I always step on that button. All right, relax your head. I'm gonna just traction your occiput. I'm gonna stretch out your neck muscles a little bit. So are you in the field? Are you at a desk and a computer?
I'm in the field.
Okay, so you're constantly moving.
Yeah.
Are you the driver or the passenger?
I'm in the car by myself right now, so
Oh,
I drive around a lot.
so it's hard to be the passenger when you're driving.
Yeah, pretty much.
Unless you arrest yourself and sit in the back and have lunch. Okay, I'm gonna get that for you. Okay, just let it relax. Nice.
That felt good.
You remember that feeling? I feel like I need to come in more.
Felt so good.
Good. You needed that. I was out big time.
Yeah.
Uh-oh. Oh, Lucy's coming to help adjust. All right. Let me try that one more time. Drop here. And See, she knows when to distract you. Can you wiggle your toes for me? Okay, so tell me about your ankles. What's going on?
I think it's my right ankle mainly, but back when I played football, I twisted it a lot.
Okay.
And now, anytime I go to play like sports, I can feel it. It feels like pretty weak.
Where are you feeling it exactly? On the medial side, the lateral side?
I think it's more the outside. Like,
out here?
Yeah.
Okay. So a lot of times what happens is when you roll your ankle, you roll it internally and you stretch out your pronatus, longus, and brevis. And that could be a little loosened and weak and not as tight. So then people are more prone to get an ankle injury. So what I'm going to do is I'm going to have you lay on your left side. I'm going to just kind of break up any adhesions along this chain here. Is this the area that you usually fill it in?
I feel it like kind of at the base a little bit.
In here or down here?
I think a little bit like down there a little bit.
Okay, and anything up here?
It's hard to say. It's mainly like when I'm like in the act of like doing whatever sport.
Does it keep you from doing a sport?
No, it doesn't keep me from doing it. I just kind of feel like sometimes I feel like I'm gonna roll it.
Okay, so what I would suggest you doing is putting on a little sleeve just for support. You can get the neoprene that slides up and then it has a little extra stretch that adheres and crisscrosses. That will give you a little more support so you won't feel as if it's going to roll.
Okay.
Is this tender?
Not tender. It does feel
Because
good.
you have a lot of, you don't have a lot of muscle, you just have a lot of little bones in here.
Uh-huh.
How many times would you say you've sprained your ankles? A lot.
Yeah, there was like one point in time where I don't think I ever didn't have my ankle sprained in football. Like I sprained it and then let it heal a little bit, sprained it again, and then I'd kind of be still playing on it, but just have it taped up.
Was it grass or turf?
Probably both, but mainly turf.
Yeah. It's unfortunate.
I think one time I had someone land on it, and that's what happened too.
Once you sprain it pretty bad, and it doesn't heal correctly or all the way and you go back and play, you could be more prone to spraining the same ankle over and over. Are you ticklish? Are you?
A little bit.
And not that I mean to tickle you, but you want to make sure you roll out your the bottom of your foot, your plantar fascia,
Uh-huh.
because it's all interconnected. And one thing can cause a problem somewhere else. You okay with that, or is it?
I'm okay with that.
If I did this on my mom, or even got near her foot, she would kick me in the face. She's kind of a ninja that way. Alright, so right in here, huh?
Mm-hmm.
Do you still play sports?
Nah.
Alright, lay flat on your back. bend this knee, bring this all the way up. Everything's in place. That one moved.
Yeah, I felt that one.
Yeah, you probably have a lot more scar tissue in that one. And that one cracked too. So sometimes what happens when we have an injury, over a long period of time, we have a lot of scar tissue that goes into the joint. Little things can just get it to move out of place and cause pain. So lay in bed, bring your toes up and down, splay your toes out, do circles both directions, go side to side as if you're waving. So go ahead and do that with your feet. Just pumping the gas and then opening your toes when you come up now. It's kind of like foot yoga. And then doing a circle one direction and open those toes and splay them, and then doing the other direction. You'll get oscillations and cracks. There's so many little bones in the feet that you can get things to shimmy back in. So do that often, and definitely wear support
Okay.
when you go to the gym.